And now what is happening in alcoholism? This prefrontal cortex is being affected. So that is the reason somebody under the intoxication or somebody who's addicted to the substance is not able to take the right decisions. Somebody who drives the vehicle at 50 kilometers per hour speed after the consumption would want to drive it at 150 kilometers per hour. Somebody who talks at a very low voice normally becomes argumentative, becomes aggressive after the consumption or intoxication of alcohol. All of that is because your prefrontal cortex is being slashed or it is not being let to work. Now, like I said, this basal ganglia. Now, coming back to the basal ganglia, which is all about pleasure and all about habit formation. This is not just about habit formation or not just about pleasure, but some of the important activities also takes happens in basal ganglia, like an individual's movement or individual's day-to-day activities like food, sex, happiness. All of them is coming from basal ganglia. Now, what is happening during alcoholism? There are three stages. If you can see in that circular manner, it is written the first stage as binge or intoxication, the second stage is withdrawal, and the third stage is preoccupation or anticipation. Now, what is binge or intoxication? Where this person is first exposed to a substance, he is exposed to alcohol for the first time. A 15-year-old boy, his senior tells him you should drink because drinking is a manly thing, and he believes his senior and he starts consuming alcohol. The first time he takes it, he does not really enjoy it. There is a fear inside him, and at the same time there is a guilt because he knows that alcohol is bad. Probably he's heard it from his family, but he does not really enjoy that first drink. Now the same senior makes him drink the same alcohol again for the second time, for the third time, for the fourth time. Now what happens here is this alcohol or this substance that is going into the brain starts hijacking the whole reward system. So basal ganglia is supposed to be taking care of the reward, but now basically alcohol becomes the key for basal ganglia. That means unless the substance is there, basal ganglia is not interested in getting activated. That is because a normal activity like eating my favorite food, or going for an exercise, or meeting my friend, if it is giving me X amount of dopamine, that is the pleasure hormone, psychoactive substances could be giving 3x or 4x of that dopamine. By alcohol, my brain is not really interested in simpler activities, because I know that just one drink of alcohol is going to give me excess of dopamine which my brain needs or which my brain is enjoying. So that way, during that binge drinking or due to the constant alcoholism, the reward system of the brain is being hijacked by the substance. That means that area is only getting activated when the substance is being taken, and it is activating dopa, or it is activating some opioid receptors. So this is how the whole addiction process starts, where your basal ganglia is being controlled by the substance. After a little more while, so now from regular consumption we have come to a state where the substance is controlling basal ganglia. The next stage is you don't even need the substance, just a stimulus is enough. So something like, I meet a friend of mine and I suddenly want to drink because I remember drinking with him, and my brain starts craving. Or I walk into a theater which is all dark, and it immediately reminds me of a pub or a bar that I went into, and it starts giving me that craving for alcohol. Or I celebrate a festival like Diwali and I remember, oh, last year Diwali, my friend had come down from the US and we had alcohol. So let's have alcohol right now. Or I feel happy about something and I remember the last time I was happy, I was drinking and I want to drink. I feel sad or stressed about something. I immediately feel, oh my God, I'm stressed. The last time I was stressed, I had cigarette. So let me have a cigarette right now. So that is how the brain, starting from a phase where it is not enjoying the substance, goes into a phase where it starts enjoying the substance, and gradually goes into a phase where even though the substance is not there, things around me, the stimulus around me starts giving me that craving and wants me to go and consume that substance. Now, what happens after a little more while is the brain is no more enjoying the substance. So we've again come back to stage one, where the brain is not enjoying the substance anymore, because when you're constantly having this substance, the sensitivity increases so much that the number of receptors start reducing in your brain. So initially you didn't like it, then your brain wanted it, then your brain wanted it to the highest extent, and now your brain does not want it. So you could be asking me, if the brain does not want it, is it not easy to stop? But here, every time the brain is not enjoying it anymore and the individual wants to stop it, it is the next thing, the amygdala, which is creating a problem. So this amygdala, every time you try to stop it, is creating those withdrawal symptoms, which makes the person goes back into the drinking. And this is what a lot of patients who come to us tell us. They say that, sir, I don't enjoy drinking anymore, but every time I try to stop it, my heart starts pounding, I'm having irritability, my hands start trembling, and that is why I'm going back into drinking again. As a postgraduate, when I was studying, one of the first ever alcoholism patients that I have seen. So he came down to me and he said, he's come down for help with alcoholism. And when I started taking history, I got to know that he is a chef in one of the restaurants that we regularly go to eat. So him, because I really like the food that he makes, and we regularly go to his restaurant. And then from his history I get to know that he's not enjoying alcohol anymore, but when he wakes up in the morning, if he does not consume alcohol, his hands are shaking. And now, being a chef, he cannot accept the shakiness in the hands, because he needs to be holding the utensils or the materials that he needs to cook. So for that reason, he told me that he consumes 90 ml at 8 in the morning, and then he goes to work. And that's probably the secret for all the great cooking that he has been doing. So just imagine, somebody who loved his food, and, I got to know that, he drinks alcohol and he cooks food. That created a lot of fear. But coming back, basically what I was trying to say is, there is that phase where the individual is not enjoying the substance anymore, but that individual continues to use the substance only because the brain is not allowing them to come out of that particular substance. So basically, the basal ganglia is the first one to get affected, and then the amygdala is causing a lot of stress, that is the negative fears, which is not letting the individual come out of it. And now, when the individual is not able to come out of it, the prefrontal cortex, which should be giving you the right advice, because like I said, the prefrontal cortex is all about giving you the right advice, right decisions, right judgments, but that is also not really functioning, because all the alcohol that you've been taking has been harming these areas. So the prefrontal cortex also tells the individual, go have another drink and you'll do better. So the prefrontal cortex, instead of telling, go to a mental health expert and seek treatment, is telling him, boss, don't worry about all of this. You take alcohol, you're going to do fine. And that is how this whole vicious circle of consuming the substance again and again, even though the individual's brain is not at all accepting the substance anymore, continues, which is the whole neurobiology of what addiction is. And this is the neuro adaptation. This is what I spoke about, how in a withdrawal, what happens is, you've been taking the substance for a continuous period, and when you try to stop it, the brain, does not like it, because all of a sudden there is a sudden drop in those values. So, basically the brain naturally stops producing the dopamine because you're giving it from outside. So now the brain, like I said in the previous slide, the whole basal ganglia is being controlled by the substance. This is not producing the dopamine anymore. It is only the alcohol coming from outside, or the nicotine coming from outside is producing the dopamine. And now when you stop giving it from outside, the brain does not know what to do, because it has stopped producing it. And there is a shortage. And that whole shortage causes the whole withdrawal symptoms, which makes the person go back into that particular substance. A few real brain images